Paula Cunningham of AARP. Welcome to American Black Journal.
Thank you. It's an honor to be here. Look forward to chatting with you and appreciate all the good work that you do.
It's great to have you with us. So let's start about this health and wealth agenda for African American women. And I'll say up front that AARP kicks in when people turn 50. That may have just happened to me in the last.
Welcome. It's a good place to be. You live your best life after you're 50 and above.
Oh, that's true. But tell me about this health and wealth agenda for Black women over the age of 50.
Yes, and it really it's over the age of 50, and for all of our future centenarians and others who want to reach that milestone. We had an event where we pulled together almost 500 African American women throughout the state to ask them about their health and wealth agenda in October, and it was amazing to hear the stories that the more things change, the more they stay the same in so many ways. Issues around health, issues around wealth and access to wealth. People often say, you're looking for change in this next administration. Well, quite frankly, Stephen, we are the change. We are the hope that we want to see. We are the hope. We are the change for the future. And so some of the things that we want to see happen, that we'd like to see change, regardless of who's sitting in the White House, is more access to health. People who are over the age of 50 who are caregivers. More women are caregivers than men. I think something like 60% of women are caregivers, 1 in 5. We have 22 million African-American women in the United States, 22 million, and we spend $1.2 trillion. That's our economic buying power. So we have a voice. We have a voice, and that voice needs to be lifted, and it needs to be heard, and it needs to be acted upon. And some of the things that folks want to see actually is again, major source of growth in Black businesses. There's been some major entrepreneurial initiatives out there, but still lack of access to loans, business loans, lack of access to venture capital, lack of access to government contracts. And so we will figure out what we need to do to be innovative, creative, and entrepreneurial, but we need the same access to resources that others receive. When it comes to Black women as well, you just look at what we earn on a dollar. I think it's 61 cents for every dollar that our white male counterparts earn. That's ridiculous, because there's even white males will say that Black women work harder, twice as hard or 3 times as hard as we always have as anyone else. And to only earn 61 cents on a dollar is another change, that we'd like to see. And as a result, in health, we're all COVID. We're thrilled that a vaccine may be on the horizon. Will it be affordable? Not only that vaccine, but what about your blood pressure medication or your heart medication? Access to lower prescription drug prices is another area that the Black women have continuously, and AARP has continuously fought to make certain that we have access, even in our food deserts and our nutrition and in urban communities, and you're not having a grocery store or anything green for a mile or 2 miles away. It's absolutely ridiculous. It's absolutely ridiculous. And so the playing ground isn't level. It's never been level, and it seems like it's getting a little bit bumpier. But the good news here is that there's so many African American women who are coming together, lifting their voices to say, we want to see some changes.
So where does that day start? You can't just count on change in administration in the White House, even though Joe Biden is a Democrat, even though his vice president is going to be a woman who's African American. You can't necessarily assume that the policy changes will follow. So how do you make sure that there is a shift away from at least the last 4 years, if not the last 50, in the way that?
Yeah, if anyone thinks this is an overnight, you push a button and everything changes, then you're going to be very impatient. You're going to get very impatient, very frustrated. These systemic racial disparities have existed for a very, very, very long time. And it's going to take a collective will of the people, and particularly our voices as well, to continuously be lifted up with our local elected officials, with our state, as well as our federal elected officials, who we vote into office. is important, whether they're Democrat or whether they're Republican, as long as they advocate for the issues that we are important to us. And so, not AARP is nonpartisan. Not, we don't have a PAC. We don't get it. We're nonprofit, nonpartisan. But we go after the issues. We listen to the voices of the people, find out what it is that they want to see and what they, what's important to them and their families, and that becomes our advocacy agenda. And particularly whether it's Hispanic, Latino, whether it's African American, we're listening to make certain that everyone has the same access to healthcare, to wealth, to lower prescription drug prices. Social Security, we've heard over and over again about, we might have to have some cuts in Social Security. Do you know how many people depend on that for their livelihood? They retired as a result of that. So that's another change to writing your legislator, calling, talking to folks, having listening sessions like we did in October when we had, the women kept coming together. We sent that agenda to every elected official and said, here's what folks in Michigan, African American women in Michigan, a battleground state, a swing state that you're going to always pay attention to. And, women vote. We vote more than men do. We go to the polls at a 68% percentage in terms of African American women. We vote. Our voices are heard. So, we just have to hold people accountable. And again, I don't look for someone else to make these changes or to say, what do you want? We've got to lift our own voice up. We are the power. We're over $1 trillion in economic, in our economy, consumer spending. Look at what happened in the polls, in Detroit, and how we can make the change that we want to see. We just have to be consistent and continue to beat the pavement and talk to our elected officials. And pay attention to who you're bringing in. It's not who's the cutest or the tallest or who talks the smoothest, but who's going to get something done. And just the fact they're sitting in the White House or sitting in Congress doesn't mean they're going to get it done unless we continue to make those phone calls, continue to push that agenda in front of them, and continue to talk about the issues that are important to all of us, but particularly to Black women in this case.
I want to talk specifically about wealth building, which is something that it's not just an issue for African American women, but all African Americans, right? What are the things that you think people need to be focusing on in that realm after 50?
Well, after 50 and even before 50, quite frankly, one is huge, is financial security. The fastest growing segment of our population are people who are 85 and older. That's good news. Yay, that's wonderful news. 80 and older, we're going to live a long time. The bad part of that is that we don't have the financial resources to have the same quality of life once we get that age and beyond. And so financial security and making certain that you have access to savings. Right now, it's such a complex industry. You don't know who to trust, who not to trust. There are fees up front, there are fees at the end. And so we are consistently lobbying our state legislators to have some kind of a work and save program, to have the state even have some kind of a work and save program where people can put money, even if it's 1% or 2%. It's amazing what that will do. If you're 50, if you start when you're 50 or 45 and you go through the age of 65 or 75, but some kind of additional financial security in the work and save program. Also to make certain that there aren't any cuts, not only are there not any cuts to Social Security, but that we grow it, not just necessarily according to the consumer index, but that we grow it. I mean, in terms of our wages and the cost of living, all that changes significantly. So that's something else that people need to pay attention to. And then your own health. People think about retirement, but they don't think about how I'm going to have, my insurance might be gone. My employer paid so much for my insurance. Now I'm going to pay for that insurance. Is it affordable? Is it accessible? Can you get the prescription drugs that you need? Why do people go to Canada to get prescription drugs? I mean, that's insane. It's absolutely insane. Why aren't we manufacturing those drugs at a rate that people can afford them right here? We've interviewed so many people, Stephen, who have cut their medications in half because they had to make a decision whether to take the medication or to pay their rent or to pay their mortgage or to pay their car note. And we should not have to have those kinds of decisions. And so making certain that you have healthcare coverage as you get ready to retire, as you age, and that healthcare coverage is something that you're going to have for a very, very long time. I know there's a lot of talk about the ACA, and it's been phenomenal for a lot of folks, but is it going to still be around? What's going to be available? And is the cost going to be prohibitive for folks who one day will find themselves on a fixed income? So financial security, your health, making certain that you actually have access to medical treatment. It's absolutely mind-blowing when you think how people miss a doctor's appointment because they can't get there based on transportation or because they just don't have the money, or they don't have, for a multitude of reasons, they just miss their doctor's appointments. So having access to good quality health care is another one. If you've got health and wealth, I mean, you can just about make anything else work. But those are two important elements that we continue, or two important issues, not elements, issues that we continue to advocate for and will continue to advocate for.